Ask Me Anything with Dr. Twyman, helping you become heart attack proof since 2019 when I launched Apollo Cardiology. Hope you guys had a great week. Tonight we're going to answer some good questions about LPA lowering drugs, saw some questions about omega-3 supplementation, so we'll just jump right on into it. So first question for tonight, does the Cleveland Clinic do similar testing and provide preventative strategies such as you? The short answer is they do the advanced blood work like I do, but they do not offer the same endothelial function testing or a lot of the quantumology things that I offer or things that would focus on mitochondrial function. So Dr. Mark Hyman was the functional medicine director at the Cleveland Clinic and was bringing a lot of the advanced lab testing there. I don't know if he's still doing anything with them, but the endothelial function testing, I learned that from Dr. Mark Houston and have had that in my practice since at least 2019. So they do the lab work, but they don't do the vascular testing. But they're a great hospital if you have major cardiovascular issues. Second question tonight, is taking vitamin D without K2 not good for the arteries? Potentially. Vitamin D is a hormone. Vitamin D helps pull calcium from your gut that comes in from your dietary sources of calcium. And with vitamin K2 on board, that helps shuttle the calcium into your bones. Without enough vitamin K2, there's a risk the calcium will be deposited into the arterial walls or increase the risk of kidney stones. So generally, if you take any supplemental vitamin D, which should be under a doctor's supervision, you generally want to have vitamin K2 with it. I've definitely seen some people get themselves in trouble taking too much vitamin D, and they get what's known as hypervitaminosis D. Next question for tonight. My partner leaves a very dim light on overnight. How bad is this for our circadian rhythms? Any light is abnormal for your biology. Even 5 photons of light can be detected by your melanopsin receptors in your eyes and on your skin. So it should ideally be pitch black in front of your face in your bedroom. So if it's not, then you want to try to use blackout curtains. You would like to use, eye shades if needed, and then figure out if there's any way that you could switch to a red light if you need a night light at night to be able to see in the hallway if you had to get up in the middle of the night. Next question, when will the medicine to help LPA be available? So good question. Right now the only really effective treatment is apheresis, where they take your blood out, they spin it through a machine, pull out the LPA, and put your blood back into you. There are some academic centers that offer that in the US, but not very many people sign up for that service. The PCSK9 inhibitors, such as Repatha, may lower LPA by 20 to 30%, but that's not yet known to be that clinically significant. The antisense oligonucleotides and the small interfering RNA molecules are still in phase 3 trials that are required by the FDA. The phase 2 trials had shown that these drugs are very effective at lowering LPA in the order of 80 to 95%. But what they're still trying to show, and this is a hurdle that the FDA has put to the companies, is that they have to lower MACE, major adverse cardiovascular endpoints. So they have to be able to reduce the risk of heart attack, stroke, requiring stents, bypass surgery. If they just make the labs look pretty, they're not going to get approved. But from my understanding, these trials were supposed to have been completed this year, but it doesn't appear that they're going to be. So I think the standard thought is that it'll be 2026 or 2027 before the drugs first hit the market. And when they hit the market, they're going to really only be initially approved for patients who are secondary prevention, people who've already had cardiac events. Next question tonight. I've heard that in some cases it is good for cardiovascular patients to donate blood. Is this ever true? There's very few things that are always or never, so it is possible, particularly if you have hemochromatosis and you have evidence of iron storage overload, you have an elevated ferritin level, then in that case it may be beneficial, but not for all. The case is you do not want to have anemia from donating blood too much. Without enough red blood cells, you put stress on the vascular system. So in some cases, yes, but it's mostly guided by your hemoglobin and ferritin levels. And then the last pre-submitted question tonight was how much EPA and DHA should be taken in daily for optimal heart health? Generally about 2,000 milligrams, and ideally from cold water fish or things like oysters, mussels, or clams. All right, so those were the pre-submitted questions. If there's anybody who wants to ask a question, then drop them in the comments and I have to answer for you. We're waiting for any of the comments to fire up. I will be attending a longevity conference this week in Las Vegas. I've attended for the past few years. This is where all the top minds in health span and longevity speak. My good friend and colleague, Dr. Gabrielle Lyon, is going to be the headlining speaker on her platform of muscle-centric medicine. I'll be attending that conference as well. And then in the expo hall, I'm going to look for all the newest and latest, greatest toys that I might be able to bring back to polycardiology to help people screen themselves better, to help them continue to become heart attack proof. I'll be speaking at the Calvary booth on Saturday, talking about some of the biohacking toys I use to screen vascular health. So things like Oura rings, things like Endura 3 monitors, and a couple other toys that I'll be showing, such as the Helo Band. So if you happen to be in Las Vegas for the longevity conference, look me up. I'll be around. While we're still looking for any comment questions, my school community is growing. We're well over 30 members so far. So right now the platform is once a month. We do at least a live where we answer any questions that people have, and it's face to face, so we can go back and forth a little bit more than Instagram allows us. And then on Mondays I put up a kind of a poll or a kind of a story in my school community, and people can submit their questions much like these Instagram questions, but I'll do a full video review of their question and give them an answer of what I would do if it is something that they need to optimize for their lifestyle, their supplements, or their medications. So if you're potentially interested in more education, things like that we're doing here, just more of the same but better, my school community, it's drtwyman.com/school, or if you go to school.com/drtwyman, you'll be able to find our community. So at least until the end of the year, there's still going to be a free 7-day trial, so there's no financial cost to check it out. If it seems right for you, there's some courses you can see that I have in there that teach you how to read your own labs, how to become heart attack proof, what vascular testing that I would consider doing, what testing I do for myself, what testing I do for my patients that come to see me in St. Louis at a polycardiology. All that is in the school community. So I don't see any other questions coming in tonight, so I'll make it short and sweet for you guys. So we'll let you have a great rest of the week. If I learned something really cool at this longevity conference, you guys will be some of the first ones to hear about it next week when I do my IG Live, 6 p.m. Central Time. Have a great week, guys.